Lead, a highly toxic metal, has posed significant health risks to humans for centuries. One of the most notable instances of lead poisoning can be traced back to the use of lead in gasoline. In the early 20th century, leaded gas became widely used due to its ability to prevent engine knocking and improve performance. However, the unintended consequences of this seemingly beneficial innovation were devastating. Lead particles emitted from car exhausts contaminated the air, soil, and water, leading to severe health problems. Asthma, neurological disorders, and even death were common outcomes of prolonged exposure to leaded gasoline. The detrimental effects of lead in gasoline were not limited to the immediate vicinity of roads and highways. The airborne lead particles could travel long distances and contaminate entire communities, especially those situated near major transportation hubs. Children, in particular, were at a higher risk as they often played outside, inhaling lead-laden dust and absorbing it through their skin. This chronic exposure had profound impacts on their cognitive development, leading to reduced IQ, learning disabilities, and behavioral issues. As the evidence of lead's harmful effects mounted, public health officials and scientists began to raise concerns about its continued use in gasoline. However, the lead industry vehemently denied any wrongdoing and lobbied aggressively to protect their profits. It took decades of research, advocacy, and public pressure before substantial action was taken. In the 1970s, leaded gasoline was gradually phased out in many countries, leading to a significant decline in lead levels in the environment and a subsequent improvement in public health. While the removal of lead from gasoline marked a major victory for public health, another infamous source of lead exposure emerged: lead-based paint. Lead was commonly used in paint formulations to enhance durability and color vibrancy. Houses, schools, and other buildings painted with lead-based paint became silent sources of poisoning, particularly for young children who would ingest paint chips or inhale lead dust created by deteriorating paint. The widespread use of lead-based paint and the subsequent poisoning it caused resulted in a public health crisis. The devastating effects were especially prevalent in lower-income neighborhoods where proper maintenance and rehabilitation of old housing stock were lacking. Children living in these communities faced heightened exposure to lead and experienced severe health complications. Lead poisoning became a social justice issue, exposing the disparities in housing conditions and underscoring the urgent need for interventions. In response to the lead paint crisis, regulations were implemented to limit the use of lead-based paint and ensure safer housing conditions. Efforts were made to remove lead hazards from older buildings and to educate the public on the dangers of lead exposure. Although progress has been made, the legacy of lead in gasoline and paint continues to impact many communities, especially in developing countries where the phased-out practices are still prevalent